All right. Good evening, folks. My name is George Burnett.
I'm Yaz.
And I'm Carson.
So we are all third year, rising fourth year students here at the University of Colorado. Want to give a big thanks to the Alumni Association for making this project possible, and also a huge thanks to our faculty mentor, who's Dr. Heather Cassidy. For those who don't know Dr. Cassidy, she's one of the co-directors of the Colorado Springs branch LIC. She's the director of the community engagement division of that LIC. So she's kind of a rock star in our eyes when it comes to this kind of work. The project that we came up with was to improve access to primary care for our folks living right in this neighborhood around us. So we know that the University of Colorado, the School of Medicine, and the UC Health System is a beacon of health for the whole state of Colorado and for the nation. But we thought that it was kind of a shame that, just a brief needs assessment demonstrated that our neighbors right here around us had pretty poor outcomes when it came to things like screening, follow-up with primary care, management of chronic conditions such as diabetes and hypertension, which is where we got the idea for this project. Do you want to talk a little bit about how we started out?
Yeah, sure. So we started off with a grant from the Slay Community Health Project earlier, I think it was 2020, and basically started with talking to the community and kind of driving down Colfax and asking around with barbershops, nail salons, and really seeing if they're willing to partner with us. And we found that a lot of people were really happy to kind of get some attention from the medical community. I feel like there was multiple barriers from like cultures to financial barriers, and just being in the community, we were able to see that need, and we distributed multiple blood pressure cuffs from that grant to barbershops. And then using the money from this grant, we were able to kind of expand and get more business partners working with us, along with expanding into giving posters out that have more people that are waiting for their haircut or to get their nails done involved in the project. So here's some pictures of us working with some of the community members, and this particular picture was like when we're going in there talking to the people at this barbershop. They wanted to get their blood pressure checked by us like right there, so we're like, okay, let's give this a try. So that kind of showed that a lot of people are actually really open to it, and we just needed to introduce it to them. And the other things that we've done is expand to all of these other places, kind of shown. I don't know if this laser works, but here, and here's some of the places that we've been able to partner with.
Not live, no worries.
Oh, okay. And then we've also built a website so that way people can see what their blood pressure reading means, and have like different options to treat it. So we have a link to the student clinics in the areas, as well as cookbooks and information on the DASH diet. So that way there's like a different way to kind of work on blood pressure for different populations.
Mm-hmm. Yeah, and I'd say, like, at least in my eyes, one of the best parts of this project has been kind of developing this partnership and this community over time. So this is a longitudinal project for us. So every so often we'll go back to each of our partner sites, and we'll kind of assess how the project is going and try to figure out in real time what's working, what's not working, how can we improve this to make it more accessible, to reach more folks. And I was down in Colorado Springs for the last year, so maybe Carson can speak a little bit to some of the things that we uncovered when we would go back and talk to these barbers and nail salon owners, some of our partners.
Yeah, so pretty much right off the bat, we realized that our English poster was not going to cut it because most of the clients in these barbershops and nail salons did not speak English. So that was our first step, was go reprint all the posters in Spanish and make a Spanish version of the website. We have gotten a lot of feedback on our poster size. So Yaz is holding a very small poster here. We got feedback that nobody was looking at it, nobody could see it. So we made much bigger posters. One other thing that we kind of realized while we were in the salon one time was that not everyone actually knows how to use QR codes. Because they said, oh, well, how do I get more information? We said, oh, just scan the QR code. And they were like, we don't know what that is. So kind of also putting the website URL on the poster, I think has helped. I think
we have another slide after this one.
Yeah, so here's like a picture of the website we made. And like I said, it has information on where to get care, as well as different lifestyle recommendations for people to access after they get their blood pressure reading. One of the main reasons we did this is because we wanted to take away the barrier of having a health professional there. So the blood pressure cuffs are electronic and they're able to find information and use it without having the pressure of someone from the medical community in that area, because I think that kind of is a big cultural barrier depending on what community we're in. And then we also, like Carson mentioned earlier, we kind of ran into realizing that a lot of people might not be able to use QR codes, and then also there's a language barrier we didn't expect. So we were able to make the website both in Spanish and English, but as time goes on, I think we're realizing that there's a lot more cultures, and that's not going to cut it. So we probably and here's some of the things that we talked about that we ran into. So there's accessibility to our to the posters themselves and the website, and then building trust was a big thing for on Colfax. We didn't want to seem like we were, going in there trying to change everything. And sometimes people think that they have to pay for the blood pressure cuff. And so kind of taking the time to explain what the project is and getting the owners on board so they can really push it for others. And then we had one cup that actually walked away, which is a funny story. And I'll let Carson talk about that.
Oh, we just got feedback from one of the shop owners that his customer kept coming back in every day to use the cup, and then decided he wanted to take it home so that he could have it for himself. So we're gonna work on getting that back, but that's the only one that has gone missing so far, which I think is a success.
Yeah,
I was expecting that maybe more of them would disappear.
And now we know there's at least one individual who has an incredible increase in their access to blood pressure screening. We have another slide that's next steps.
And then here's kind of our thank you. And here's a picture of us with a new barbershop that we just got added like a couple weeks ago.
Yeah, so this is going to be an ongoing effort for us. We're going to continue to expand into more venues, both along East Colfax and some other neighborhoods that we've identified nearby. One of the things that we're really excited about is that we just received IRB approval to study some of the outcomes from this project, because we thought, it's great if we are getting, anecdotal feedback when we go in that people like the cuff and that it's helpful for them. But we wanted to try to find a way to actually quantify that impact. So some of the things that we're going to be studying based on this approval that we have, we're first going to be looking at the cuffs themselves. So the cuffs store up to 200 readings, and we can transmit those via Bluetooth to an app where we're able to put them all into Excel and run stats on those. We're also going to be looking at metrics from the website utilization. So that's going to be, how many people clicked on the cookbook, what was the rate of referrals over to the Dawn Clinic. And then we're considering kind of running some semi-structured interviews with our community partners so that we can perhaps do a qualitative analysis, that we can kind of get a better idea of what's working, what's not working, so that if other folks want to try to replicate this work at other institutions, or we're looking for ways to make this an even stronger program, we'll have more than just the numbers. We'll have some of the why and not just the quantitative stuff. That's enough. We'll take any questions.
Great. By the way, do you have any idea among the patient that you get blood pressure, how many of them have high blood pressure undetected before? So newly diagnosed based on your efforts.
Right, that's a great question. I think one of the difficulties that we ran into is like we don't identify the patients. So it's hard for us to know like who exactly got their blood pressure reading. So we're not sure what their histories are. But we have, like George said, started collecting those blood pressure readings, and we don't have the stats yet, but that's one of the things that we want to see is what is the average blood pressure reading and has it gone up, down, with like multiple readings. And the idea is that if someone comes to get their haircut somewhere, they usually come back so they can get their blood pressure checked multiple times, and that just empowers patients to know what their blood pressure is.
And I'll comment that we also have a survey. So as part of the IRB that just went through, there's a brief survey. It only takes like 30 seconds to complete, but it asks things like, do you have any underlying medical conditions? Do you take any medications for high blood pressure right now? Do you have a primary care doctor who you're seeing regularly? So we think that as we have some of that survey utilization information come in, we'll be able to answer that question a little better.
Kind of mentioned this, but I'm just wondering, so like if I was walking in and I had no medical training, I might not know what high blood pressure was. Is there a way that they can know like, oh, I should follow up with this, or oh, that's fine?
Yeah, so we have a poster that's right next to the cuff, and it kind of has a chart, meaning like this is normal, high, very high, and then like a recommendation to follow up with a doctor. Like if you were in this category, that's not good. But it's also hard to, know exactly what people are doing with this information.
Great project. When you guys realized you needed more language resources, did you like pay an interpreter service to translate your posters, or do one of you just speak Spanish? How did you guys do that?
Oh, we actually didn't do either. So we do a little bit of like kind of interpretation, and Carson knows some Spanish, so we use that as help. But I think like as we move forward, we would want to have students maybe that speak Spanish and speak languages that we're seeing in the community. That way they can communicate a little bit better.
Thank you.